Good morning and welcome to the Respiratory Futures February pre-election special. I'd like to introduce Dave Roberts, our host for today. Dave has significant experience of both communications and frontline politics from working in the NHS and as a political advisor, and he remains active in politics at national, regional and local levels today. Over to you, Dave.
Thank you very much, and good morning all. Today we're going to try and spend 20 minutes looking at what the general election might mean for broadly for healthcare and for the respiratory sector in particular. We'll take through looking at the politics of the election, the manifesto and policy priorities of some of the parties, and what this actually then means, and what maybe people could do after the election. So that's kind of what we're going to look at and what we're going to discuss today. And please do submit some questions and keep me on my toes, because that's always a good thing to do. And the thing about elections is that there's an awful lot of noise. There's a great amount of hullabaloo about an election. Those people in the media absolutely love them. It's the time that the BBC and Channel 4 and Sky and everybody else's political departments has their 5-yearly kind of rave, so to speak, and the politicians play along with that, and a large degree of the public play along with that as well, and an awful lot of people completely ignore it. But does it actually tell us anything? Does it actually tell us anything about politics and policy going forwards? And you know, that really does depend on the area in that you're interested in, and the degree of openness by politicians, because there are two very clear examples of where politicians have kept things very, very secret and kept things to themselves. In 1997, Labour told nobody about their plans to give independence to the Bank of England. It was actually kept confidential within their own party. Very good reasons for doing that, because it would have affected the markets and all that sort of stuff, but they were, you know, it was probably the best kept secret. And actually, you know, maybe for less noble reasons, the Conservatives had stated that in 2010 there would be no top-down reorganisation of the NHS, and then they changed their mind and did the complete opposite. And maybe that was because they didn't actually want to have the discussion in 2010 about the future of the health service, as at the time they had spent a long time detoxifying their brand around healthcare. So hullabaloo, yeah, you know, don't be a patient during an election period or the period before, because you're going to get those chuckle brothers coming to visit, or versions of it. I think this is the English version of the chuckle brothers, isn't it? Because that was the Northern Ireland leadership described as such. So, yeah, what's the campaign, the election campaign, going to actually look at? I mean, it's going to look at the economy, it's going to look at austerity, levels of austerity, ways of addressing austerity. There's going to be a debate around immigration. The Conservatives are going to have that because of the pressure from UKIP, and the other main parties will have to therefore tackle that as well. Tax and spend, welfare state, levels of benefits, that sort of stuff is going to be in there. The NHS does get up there on the list, especially from a Labour's point of view. They want to talk about the NHS as much as possible. Education, and then world events. We never quite know what's going to happen. Terrorist attacks and things like that. The situation in the Ukraine, various other things will have an impact. They'll probably play to the government if they are severe events, as the leadership can look presidential and have that sort of grandiose image that people do respect and like. But governing parties do have a tendency to look at the big pictures. Opposition parties also go for big pictures, but they can only look forwards. They can't really look backwards on their own track record. So this is where governing parties have always a built-in advantage. They can say we did do something, while the opposition can only say we will do something. This election, we have an interesting thing in healthcare, in the fact that we have the three main parties have three very experienced lead spokespeople on the subject. So yeah, this is some of the stuff that we've seen in the past. The famous devil eyes. This is the sort of, you know, this is where, you know, party politics comes to the fore, and the young creatives working within the political parties and the political machine and within their agencies can have a great time. The one I actually liked is the morphing of William Hague into Margaret Thatcher. Personally, I quite enjoyed that picture. They actually had a little funny, weird hologram card where you could actually make that happen for you for your own pleasure if you wanted to. So this is the stuff that occupies the minds of many people during an election campaign. Is the imagery and what goes behind the imagery. But where we're at with the NHS, why do politicians want to talk about it? They'll talk about it because they think that it plays well with the public and because it is an incredibly important public service that is seen as one of the things that glues our nation together. And that is pretty well reflected in the opinion polling, continuous opinion polling on the health service and what we like or don't like about it. 89% public agree government should support a national healthcare system that is funded, fair, at point of use and available for citizens. Full stop. Job done. The NHS is not going anywhere in the short term. But interestingly enough, considering Labour makes the deterioration of the NHS a major theme for the election, 43% think that the NHS has neither improved or deteriorated over the last 5 years, so it's a standstill service. 26% think it's got better. Well, that gives you nearly 70% of people who actually don't think that the NHS is a particular issue in terms of it needs saving or reforming. They are either contented or they are positively happy with the way it's performed over the last 5 years. Now, you could drill down into some of those numbers and look at demographics and level of actual contact with the NHS, and you may get different numbers, but it's a snapshot of showing that actually it's not always as bad as people tell you it is in terms of what the public think. And again, there's another figures that show you something similar around whether the government should support a national healthcare system that is tax funded. You know, so there's nothing really surprising there either. It's always nice to have a graph, though, isn't it? Well, people do support it, the NHS. 43% do not have a preference between receiving NHS-funded care from the NHS, a private company, or a charity or social enterprise. So again, when you have a debate about privatising the NHS and that this is bad, actually patients don't necessarily care who delivers the service directly to them, as long as they're not paying for it and it's openly available to all. Wasting money. A large number of people think that the NHS wastes money. And if we don't have consent from the public for spending on the NHS, that's actually quite a significant problem for society. And as we look at some of this data, it does indicate that there is skepticism about how the money is actually spent. So, what do the parties say? Well, there is a level of agreement. There are agreement that the NHS needs greater funding. What level of funding that actually is does vary between the parties, but there is nobody saying we are going to lift the ring fence or we're going to cut funding to the NHS. The importance of integrating care between health and social care is a common theme across the parties. It's been a common theme for lots of people for very many years, and I reflect on the fact that when I worked in the NHS back in the late 90s and early 2000s, it was a theme that my health authority talked about a lot then. Quality and standards is becoming a more salient point for people talking about healthcare, in the fact that we have seen the consequences at mid-staffs, where people were very concerned about the standards of care there, and the government played a significant hand in saying that it was the keeper of standards and quality for the NHS. And that became part of its kind of mission, is to be a quality assessor. Personalisation of care is obviously becoming important as people age, and we're also looking at the role of prevention. These are common themes. These are themes that, you know, are a little bit apple pie-like, to be honest, but they are there between everybody. And then we have the differences. Now, the differences, you know, some of these can be drilling down into some of the sort of granular detail of policy making, because we do have these three significant individuals leading the health portfolios, and they do understand their brief fairly well. But you know, some of this stuff does actually reflect on what the parties think is important. I won't go through all of these, but you've got, you know, Labour saying that it wants to repeal parts of the Health and Social Care Act. Those are relating to compulsory competition. It wants to invest, you know, significant amounts of money in a time to care fund, and it wants to have more nurse training places and more care workers. And from a respiratory point of view, it wants to tax tobacco companies in order to pay for faster cancer test results. You look at the Conservatives. They're pledging extra funding. Interestingly enough, the NHS is absent currently from their top 5 pledges about how they're going to improve Britain if they were to be in charge. And they want to do things like cap redundancy payments. This is all about being the kind of public guardian of the NHS. And it wants more GPs, with them providing extended hours of opening and greater access to that service. And then the Liberal Democrats, again, more money. Health is one of their 5 pledges. It wants to invest in mental health, which is no surprise given Norman Lamb's personal commitment to that subject area. And then it wants to strengthen health and wellbeing boards, and that plays the Liberal Democrats' localism agenda, and you know, we see that that's probably having some impact at the moment with Manchester. So then we look at a couple of the smaller parties, and these parties are not actually going to have a genuine impact on anything to do with government policy over the next 5 years. But they are going to have an impact on the debate that we have over the next few weeks. And politically, they are having some impact. Obviously, UKIP famously is chipping away at everybody's vote. But if we look at their policy, UKIP, populistic, wants to end hospital car parking charges. No surprise there. That's a great policy to have, I think. If you want to appeal to people, it's not necessarily such a good policy in practice. And then you've got compulsory insurance for all new immigrants. Again, no surprise that you have that sort of policy coming from UKIP. The Greens, I think it is their position is sort of everything for everybody for free. But what they want to do is, in more specifics, is diverting funding from central facilities to community health centres and abolishing foundation trusts. We then get asked about the Nats and the Unionists, so the Scottish Nationalists, Welsh Nationalists, and the Irish Unionist parties. Well, they don't really have strong health policy for this election because obviously health is a fully devolved policy area, and so they would save their detailed policy making for their own elections. But health has been flagged up as by the SNP as an issue in which it would give support possibly for English health policy if it was to be able to get something back in terms of the areas that they control in Scotland. So they would horse trade health against maybe further powers in a particular area over energy or something. So then we move to the announcements this week of the projects in Greater Manchester. Ticks some great boxes for the Liberal Democrats. This is proper devolution of major levels of care and major levels of funding out to the regions. It should theoretically tick lots of boxes with the Labour Party in the fact that it does bring together health and social care. And it's a bit of a surprise for many that the Conservatives have actually fully embraced this. But what it does do is distance health policy from the centre. And this is something that they have been trying to do throughout the entire 5 years of their administration, is move health policy away from being associated with the Department of Health and basically associated with anybody else apart from them, and they just look at the quality and standards for the NHS. So, is it an exciting development? I think it is, actually. I think it could be a possible game changer. It'll be interesting to see what other cities begin to say about Manchester, and as well city regions. And it'll be interesting to see if there are any of the more rural parts of the UK, especially England, that want to take similar control. I live in Wiltshire, so would we have a southwest health commissioner? Could we have a Cornish health commissioner? What's going to happen in vast chunks of the east of the country? Are we going to have a health commissioner, individualised health commissioner for the whole of East Anglia? Nobody lives in large parts of it, but it would be quite interesting stuff to see whether this is an idea that could go beyond just big metropolitan urban areas. So it is going to be an interesting time as we see how that pans out over the next few years.
Dave, can I leap in there actually? We've just had a really interesting question from a healthcare professional working up in Manchester, pertinently enough. Picking up on this, I think people's interest, or perhaps their fears, particularly people working within the NHS, is who's qualified to steer the spend, who's qualified to make these decisions. And this particular clinician says, we at the coalface feel we're really making some good cost savings, and we're trying to be very efficient, but our case mix is more complex than ever. So how can those people in Manchester make the right decisions and get the right information to inform those decisions, do you think? Because this could have a bearing, as you say, on the rest of the country. Yeah,
absolutely. I think we have to detach slightly the strategic role that what will be the Greater Manchester Mayor will play in healthcare and the operational control. But this has been the same for many years, in the fact that politicians are generalists and strategists, and they direct funding and resources based upon their political philosophy and on the advice that they get from people around them. That doesn't change just because it's in Manchester versus being in Whitehall, or being in Brussels, for that matter, or in Edinburgh, Cardiff, and Belfast. Giving political control doesn't mean that a politician is meddling in clinical decisions or service design decisions within an acute trust. I mean, what we're looking at here, from what I understand, and of course the actual details are a little bit sketchy at the moment, is that this is emerging really of the collection of CCGs and local authority social care services to come underneath the mayor. And therefore, with the actual daily mechanics of delivering services within acute trusts or specialist centres or whatever it might be, will in the short term remain unaffected. But where the big impact will be in terms of priority setting, the shifting of funding from one area to another, and the fact that it will reflect the political dynamic of whoever is elected as mayor and whoever their supporting team actually is. So what you could well and truly have in the Northwest is a fairly solid Labour administration that could be setting itself against the Westminster Department of Health, and that could be quite an interesting dynamic politically and strategically. But it just means that there is a different group of politicians which are probably more locally accessible, using their influence to direct the funding streams and some of the priority areas.
Could we find ourselves in a situation where health rationing is employed to curb excessive hospital expenditure?
Yeah, I mean, well, what's rationing? I mean, debate. You will see different priorities being set by the Manchester administration versus somebody based in Cornwall. So we will see different levels of services. They're not going to have fundraising powers at the moment. I think that's going to be a really interesting debate over the next few years if Manchester takes off and is a success, that they may say, well, we want to raise more money in order to fund our health service in a different way, in order to avoid introducing their own localized priority setting or rationing. But we will have differences. There will be differences. There will be differences in the care services, whether it's health or social care services, in the Greater Manchester area compared to anywhere else. That's the point. That is that whether you like it or not, this is moving away from a centrally imposed NHS with the same in every part of the country. It's going to be different. It's different already, so it's going to be different. Just it's going to have a more open level of difference, and whether that's perceived by some as rationing of services in the northwest compared to the northeast or the southwest will be a matter for people to think about in due course. But it will mean that we will definitely have different services being introduced.
Thanks. Carry on.
So yeah, people do please tweet or at hashtag RF debate. I believe that's capital R, capital F, capital D, or send some other questions in for me to answer. So yeah, let's move on to a bit about politics. I mean, politics. The BMA has recently said it wants to take politics out of healthcare. I mean, it's not a viable position for any politician to say, I'm not going to get involved in the delivery of healthcare in any part of the UK. We have some quotes here. I mean, it is deeply political. The Conservatives view this as a territory where they do not have to always be on the back foot. They get slightly irritated by the fact that Labour always takes a lead on trust within health services. You've got Norman Lamb and the Liberal Democrats standing up for the Liberal Democrats version of health care, and then you've got Douglas Alexander with the big noise around cannot survive 5 more years of David Cameron. So this is highly political. It always has been. It was when the NHS was introduced in the late 1940s, and it has been really for most of its life. It's a huge area of spend. It's a huge area of public importance. It will therefore be political. When people say, well, can't you just all agree and get on with what's the best for X, Y, and Z? Well, the point is they don't agree, and what is best for one person is not actually best for another. So therefore you have to have that political debate, and we have that debate in many forums. They just also happen to have it in the political forum as well. And maybe the stuff around weaponization was careless language by Ed Miliband. But it is pretty intense, this level of debate about the NHS. Lots of noise, and I can see why the BMA has asked for no more games, but it's just not a reality. It cannot be. The government may want to try and rise above the political fray around this, but the opposition will just not let that happen. I think the BMA, I can see why they've done it, but they're not going to get people really winding their necks in on having an opinion about the NHS. We're going to see lots of attacks and debate. We're going to have private versus public. It's going to be a debate that Labour will push. I'm not sure they're going to necessarily be banging on an open door. If we looked at those statistics from some opinion surveys earlier, people don't really buy this. But in one level, they also always do, because they don't want their beloved NHS being hived off to the highest or lowest bidder, depending on which way you look at it. Then you're going to have stuff like cancer rates from Labour and Wales, which are poor. We're going to have Labour's continued legacy of being in charge when misstaffs problems occurred. We've got the public's distrust of the Conservatives generally. We've got A&E waiting times. This last winter have given ammunition to the opposition, and then we've got some quite detailed and complex arguments around the affordability of this administration's introduction of the Cancer Drugs Fund and what that could look like in the future, and how do you manage the cost of expensive drugs. That's a debate that's been going on for a long time, and it will continue to be a debate.
Dave, can I pick up on your point about the public's sort of perceived distrust of the Conservatives on health? Do you think, we've been asked whether we feel the Conservatives have any hidden policies up their sleeve for the NHS that perhaps aren't in their manifesto, or could a Tory coalition with, say, UKIP or the DUP lead to a significant change in their attack on the NHS?
I don't think there won't be coalitions with Irish unionists or others, but it's the sort of, it's called supplying confidence. So it means that you vote with the government on budget and any vote of confidence in order for there to be a stable administration. And so I don't think there'll be huge amounts of influence there. I think the Conservatives have probably learnt their lesson from the Lansley reforms and their no top-down reorganisation of the NHS statements in 2010, and then by the end of 2010 you had the Lansley reforms on the table. I don't think they'll be doing that again. Who knows? I mean, they may have something hidden up their sleeve. I can't see it. I think they want to sign up to the Stevens plan for the next 5 years and beyond. That's what they see their role now as being slightly distanced from the day-to-day management of the NHS. They have achieved that by their structural reforms. Even though we also hear that Jeremy Hunt has a habit of picking up the phone and ringing chief executives to berate them about their budgetary performance generally, so that's not very hands-off. But I don't think we're going to have any hidden surprises from the Conservative Party this time around. I think that would just be foolish beyond even the levels of some of the foolish people in politics.
Thank you very much.
I feel very sorry for this lady in this picture. Not quite sure what the hell is going on. Looks quite uncomfortable, I have to say. So what drives policies? And I mean, lots of people know this. If you've got an interest in political debate, is that Labour views the NHS as the manifestation of its collectivist ideals, and it's a living and breathing difference between the Conservatives and them. We've also got the personal politics of Andy Burnham wants to run again for the leader of the Labour Party. If there is not a Labour administration after May, he needs the backing of the big public sector unions, and the rhetoric around the NHS plays to that audience very well. The Lib Dems have had a massive ideological kind of problem about what is their USP on the NHS. But this devolution that we've seen in Manchester, the possible strengthening of health and wellbeing boards, plays to what their normal audience of localism, and they love to restate that Beveridge was actually one of their own. It gets quite boring, but they do say it as often as possible. Then you've got the Conservatives. They're struggling to be trusted on the NHS. But interestingly, the Conservative Party is badly seen in terms of its support for the NHS. But actually, there are other surveys that I haven't used here that demonstrate that David Cameron is quite trusted on it. But the Conservative brand, the Conservative Party, is not. We've also got some of the core activists within the Conservatives do actually think that the NHS shouldn't be fully funded by the public purse. And you've got Jeremy Hunt's own personal ambitions to go higher within government, and if he can demonstrate that he's a steady hand in the toxic environment of healthcare, then he can rightly expect a new role in the any future Conservative administration. Everybody likes to know how we predict election results. Well, the polls tell us one thing, that there'll be a hung parliament, that there'll be 40-odd SNP seats in Scotland. Scotland will become an entirely different political nation. The polls say Labour and Conservatives are even on the share of the vote, but that's not quite true anymore because the Conservatives have opened up a 2-point lead, and actually that lead in some polls is up to 6 points. And the polls indicate that the Greens and UKIP will do well in their share of their vote. Because their vote's not concentrated, they probably won't do that well in numbers of seats, but they could have an impact on other people's seat-winning capabilities. So my own prediction, I'm just going to build to what my prediction is. As a month-to-month, the Conservatives have eaten away into the Labour lead. They're now level pegging, if not in the lead, as a share of the vote. The Conservatives are the challengers in many of the Lib Dem seats, not Labour. So a collapse of the Lib Dem vote, if it transfers to Conservatives, goes well for them. If it fractures and goes all over the place, that does well for the Conservatives. Labour needs to get that Lib Dem vote taken from third to first, and that's always difficult. UKIP may take votes from both Conservatives and Labour. And Labour can quite easily be squeezed by everybody, by the Greens, by UKIP. There's a strong anti-European history within the Labour movement, and a lot of the core votes have communities have seen intense levels of immigration over the last decade, and there is a, at times, a fairly volatile atmosphere within those communities, which could help UKIP. And the Lib Dems will not do as badly as people think they are going to do. I cannot believe that. They are very, very good street fighters. And the Labour core has been hit by austerity, but they have very poor voting habits. So Conservatives are also well funded. Labour is not. Labour is clearly struggling in the south and southeast to get any kind of cut through. The economy is strengthening broadly, with wages beginning to outstrip inflation. General employment is up. Ed Miliband and Ed Balls are not popular with the public. Labour is really not able to, I say may not be able to work with the SNP. I would find that incredible if they were able to. The level of animosity in Scotland is huge. And also to have a UK government reliant on the support of Scottish nationalists would just be completely untenable. But the Conservatives could work with the Unionists in Northern Ireland. So we look at some of this polling. Here we see the joys of the Labour Party dipping down below the Conservatives. That broad line there is Conservatives on the up and Labour on the down. It's interesting that UKIP are taking a bit of a downward trend here, as are the two Lib Dems and the Greens. But broadly, that's the they're the two lines that are starting to cross over one another, and that's incredibly important. Most polls do just give a snapshot, and they ignore the power of local contests. In 2010, Labour held on to a lot of seats it should have lost on the general share of the vote, which is what forced the coalition. So it is this odd combination between the views that people have about the national level leadership of the two parties, or five parties this time round, and the actual power of local campaigning. Quickly look at what is the single most important issue. People tell us it's the NHS. And then we look across there, how important do you think protecting and improving the NHS is to the various different parties? The SNP seem to come out on top, then Labour, then Plaid, and then Liberals, and there's David Cameron, and the Conservatives well down on their support.
Dave, sorry, can I leap in there? Just thinking about what drives voters, and we've recognised here, and it's been incredibly useful to recognise how important the NHS is to voters. But I wonder what drives them, what influences them. Are people influenced by the predicted future deficit that Simon Stevens has predicted in the 5-year plan, or what is influencing their votes right now? Is it the current position of the NHS or the future one?
Well, my view would be that actually the NHS doesn't overly influence their voting patterns and behaviour unless they have had direct experience of it, normally in a negative way. So if they've had a negative experience of the NHS, then they may well buy into a future look at what the NHS could be under a particular administration. Most people vote on the sort of general emotional engagement that they have with leaders and parties, and the broad sort of underlying ethos of what they think that party is going to do for them. People vote fairly selfishly generally. It is about what's good for them, what's good for their family and their nearest and their dearest. And they vote based upon some of their own personal experiences. So when you see an economy rising, the economy becomes less of an issue because people are in work and they're feeling more prosperous, so then they feel a bit more benevolent and they generally look wider for that sort of emotional connection. When the economy or employment is low, then they will be more interested in that kind of, where's my next wage slip coming from, how much is my taxes, is the employer that I work for stable and robust, am I getting a pay rise? That's kind of the sad reality of an awful lot of voting behaviour, and intentions are often fairly deeply entrenched. But then the impact of the person on the door does make a difference, and that's how Labour managed to hold on to seats in 2010 against the share of the vote, because people were able to actually motivate people to get out and vote for what they, for the person that they saw on the doorstep. So my view is, unless you've had a negative impact from the NHS, that actually whatever people say in polls, people often want to sound more noble in polling than they actually are. And they want to sound more informed. You often have these fantastic polls that show that people support policies and ideas that never existed. We have polls that show that people claim they voted one particular way or another, and they actually never voted, because there was a register of whether you did vote. Nobody knows who you voted for, but there was a register kept of who did actually turn up at the polling booth. So they know that this person never voted, and they still tell you that they did vote for one thing or the other. So I think that how we respond to polls is very different to actually how we actually behave in practice.
Just to sort of flip the coin slightly, we're Respiratory Futures. We are respiratory healthcare professionals working in all sorts of aspects of that domain. Do you think that we, in terms of our own call to action, have we been articulate enough about the kind of impact and the burden of respiratory disease in terms of how we lobby those national parties? What are we doing as a sector, and what should we be doing more of?
I think that's quite interesting. I mean, at this precise moment in time, politics is about macro issues, and this is not, well, some people will tell you that the elections are a great opportunity to get your voice heard. They are if you happen to be in the right place at the right time. But generally, elections are about macro stuff. And they're about things like this, about leaderships, about whether people think somebody's a good leader or a bad leader. The time for doing time for influencing policy and influencing change is actually during a government administration. And I would contest that the respiratory sector has done a reasonable job in some areas, obviously around smoking cessation and its involvement in cancer and lung cancer in particular, but I would say that it probably now needs to look for a 5-year agenda, working with its local, on a more local, regional level, rather than actually on a national level. I mean, there are some things they can do nationally, which I will touch on in just a second. I've just stuck my slide up, which gives you my prediction for what the next administration will look like, which influences what I just said. I think it will actually be a straightforward Conservative government, and at the stretch, it might need some Irish Unionist support. So yes, what does this mean for the NHS? Well, out-of-hospital services will slowly grow. I think we've all seen that. I think that's going to continue. We're going to see the multiple providers embedded further. We might actually see the third sector starting to wake up a little bit more to what it can deliver and how it can take a piece of the pie. We're going to see some of the integration we discussed, and we're going to see some stuff around local public health will continue dependent on local government, obviously. And I think we're going to see Jeremy Hunt spend a year as Secretary of State for Health and then move to someone like Defence. So you could be having a completely new ministerial team. Other coalition options there. They're the ones that people talk about. Conservative Lib Dem, little change. Labour, Lib Dem, I think there's some compatibility there. So, moving on to just this final little bit of the respiratory case, what to do after the election. If my predictions are correct and we have a reasonably stable Conservative administration after the election, they will do everything they possibly can to neutralise the NHS as a political issue. There may therefore be a number of reviews and consultations, and these are really, really important for professional organisations to get involved in, because you start looking at the sort of granular detail of policy. But it's also a way for the politicians to avoid the big macro stuff. Manchester's obviously going to be a focus on an awful lot of people's attention as that develops. I think we're pretty good on tobacco control at the moment. I know there's some stuff around packaging and whether that will actually make it through Parliament before the election. It should. This Parliament's not had a lot to do in the last year, but maybe not. For whatever reason, that would be bad parliamentary management, but it should get through. But so, where should you actually look? Well, I look to place your influence. I think that it's got to be around the local level. This is what the Conservative administration has wanted to do. It's wanted to push decision making further away from Whitehall. And the levers that have got to be actually pulled will be of no surprise to anybody: saving money, ability to work out of hospital, working with in collaborations with other people, early intervention, especially in the frail and older people, patient satisfaction and personalisation where possible. Demonstrate that the patients like what you're doing, that they kind of appreciate it. Gather that information, gather that evidence, and provide some solutions for the health and wellbeing boards, which you could find being strengthened. So we then have, what would you do nationally? Well, you've got the APPG report on respiratory issues. I think you can use that to push for change, and I think that you can use some of the findings of that report fairly effectively. So, push for the national rollout of pilot breathlessness and COPD awareness programs. Early detection pays dividends. That if you think you just got a little cough, that maybe you haven't, you've got something more serious, and we can tackle that early. That is actually quite an appealing message to send to people, and I think that that's really important. I think that the stuff around focusing on children requiring a different level of service with a different sort of mindset is really important. It's about making that case and talking to people, actually having the kind of putting some time aside wherever you can to actually explain what respiratory care wants, what is the big ask for respiratory medicine, I think that it's very difficult when you're a professional organisation and when you're busy consultants and when you're engaged in the frontline services to actually look and think about what those people commissioning your service want to hear. But it is about delivering evidence around cost effectiveness, patient experience, and that, but everybody knows that. That's been the mantra for the health service for many years. But it's also about asking who actually cares about what you're saying. You have to make people care about what you're saying. Then you have to find where the money is, and then you have to find who has the power to shift those resources. Everybody has to make their case. It's a bun fight. It is like that in every sector. But if people don't care about what you're asking about, then the other two things around power and money don't really matter. So the first thing you've got to do is make the case for why it matters to people and why they should be interested. And then you can move on to talk to them further and educate them and make people advocates and ambassadors. But if you don't tackle that first part of what are your priorities and why is it that people should listen to you, then actually, you're always going to be on the back foot compared to other people who've actually got that more a more robust offer to make.
Thanks very much, Dave. I think the final question, picking up on the kind of Manchester devolution style argument of health and social care, perhaps that gives us an opportunity as a sector to really focus our energies on a particular audience with a particular argument. We want to be the lobbying voice. We know that we need a lobbying voice, and perhaps looking at these devolved areas could be a way of focusing our energies. Do you think the government has any other parts of the country lined up for another Manchester-style coup in the near future?
Yeah, I think the obvious one is probably to look at Birmingham, and then there's London. So, there are the three major metropolitan areas, however much other people may want to argue with me over the numbers of that. It is broadly the Midlands, the West Midlands and Birmingham, the Northwest coming out of Manchester. Merseyside gets a little bit hurt when you talk about Manchester, and London. So, I think what's going to happen for Manchester, what will be quite interesting, was to see if the other areas actually start asking for more. And if they start asking for more, then they're going to have to take more of an interest. So the door might well be open for more conversations. With a slightly different audience, so you're actually talking to the big, significant, powerful local government leaders rather than just talking to politicians and people in Whitehall. So you will find, I think you'll find Birmingham and you'll find London asking for more control, influence or power over health services. So you'll have a different level of debate, which will start talking about social care and health service, be the integration between them. Being more of a reality than it's ever been over the past 10, 20 years when people have talked about it but not done that much about it. This could start being a real a real debate based on actually the Manchester experience and alternatives to that.
Fantastic. Thank you very much, Dave Roberts, and thank you for bringing our attention to this really key issue. We now, as a sector, really need to decide what we want to do. Please continue the debate on respiratory futures. Please ask more questions. The system is open for another 24 hours, so send your questions through to us. And thank you very much for logging in today.